how does men contribute to infertility case in marriage? Do you think a man contributes to infertility cases? What is the cause of infertility in men? Men contribute to infertility cases. Infertility cases is not only caused by a woman. There are factors that tells that this man is fertile, and it has to come with your sperm quality. That's the major factor. Your sperm parameters. The factors that tells that a man is fertile, it comes from your sperm parameters. How healthy are your reproductive organs? Hello everyone, I'm Chinwe Edwin, and I'm still that your favorite medical human physiologist, and your healthy living is always my concern. Please don't forget to subscribe to my YouTube channel to get a notification whenever I post my video, and don't also forget to like, share and comment. Thank you so much. In my last video, I talked about infertility amidst couples, and I talked about how a man and a woman could be the contributing factor in these infertility cases. Let's stop looking at the woman as the only causative factor. Now, what are the factors in a man that could cause infertility? There are a lot of factors around you that could be affecting your fertility. Look at the quality of the sperm, the man's sperm that is supposed to fertilize the egg for conception to take place. What is this sperm like? There are parameters that tells that a sperm is very good. What are these sperm parameters I'm talking about? You have quantity of your sperm, the quality of your sperm motility, your sperm morphology. What are they like? As a man, the quality of your sperm, what is it like? The morphology of your sperm. Morphology, I mean, is the structure of your sperm. What is it like? What is your sperm quantity like? You have standard normal quantity of a sperm. Is your own sperm up to this expected quantity? Now, away from the quantity of the sperm, what is the motility of the sperm like? The speed of the sperm. How does the sperm move? How does your own sperm move? Does it move like the normal sperm? There is a normal shape a sperm is expected to have. It's not all about releasing semen. What is the quantity of sperm in that semen? How viable are they? Will they be able to conceive the woman? Will they be able to fertilize the egg to form an embryo? How healthy your sperm quality, your sperm parameters are contributes a lot to fertility. And when you find that one or two of the sperm parameters having challenges, this is where infertility begins to rise. Your age is another factor that contributes a lot to your fertility, because the more you are aging, the more your cells and tissues are aging. Your organs are as well aging. The strength you have at the age of 21, 22, 20 is no longer the strength you have at the age of 30, 35, 40, 50. How old are you? Once a man is up to 30 years and above, you see their fertility rate begin to decline. Late 30s, your fertility begin to decline. Mid 40s, your fertility is already declining. Sometimes age could affect your testis vascularization. Blood supply will reduce because of the vessels are weak. You find a lot of men having weak erection, weak ejaculation. Infection can also affect men, causing them infertile. That disease you contacted, have you treated it? Sometimes infertility could come as a result of medication. The medication you are using to treat a particular disease case. What is your erection like? Do you know that also causes infertility? It also affects fertility. Do you have weak ejaculation? How healthy are your testes? We also look at chemicals that could affect men. What kind of job are you doing? We have chemicals, we have radiation. All these things affect men. I think it's been long I came across this health talk when I went for a seminar, a health talk seminar, and we were reminded that the way men hold their phone, it is not the way they are supposed to. A lot of them put their phone in their pockets. Do you know the radiation that your phone emits can also affect your sperm quality? Yes. You see a lot of men, once they finish answering their phone, back to their pockets. How long do you stay under the sun? Oxidative stress, hormonal imbalance. You think it's only women that suffer hormonal imbalance. Men also suffer hormonal imbalance. Once your pituitary gland, your hypothalamus is affected, your hormone level, your hormone balance can also be altered. What is your testosterone like? Remember, testosterone is one of the major hormones that assists a man in sperm production. Once your hormone level is low, it's also going to affect your fertility. What is your lifestyle like? Are you among those that take alcohol? It also affects your sperm quality, you know. Those of you that smoke cigarettes, a lot of men's lifestyle have affected their sperm parameters. Things they eat, things they consume. A lot of men take alcohol and they call it normal. It doesn't affect me. It doesn't disturb me. But there is a future run negative effect that is linked with that alcohol you are taking. The cigarettes you smoke, other things you eat, are they what you're supposed to eat as a man? Once you are a man and you've gotten to age of 30 years and above, your reproductive organs begin to decline because your cells and tissue are also aging. What are you eating to nourish them? What kind of work do you do? As a man, do you even exercise? 24 hours you are seated in that office, you don't move around. You don't know it also affects your sperm quality. How often are you exposed to ultraviolet rays, radiations? Your phone is always in your pockets. Do you know your phone emits radiation that also affects a man's sperm quality and quantity? Sometimes when we're in the lab analyzing the sperm, you find that some persons, their sperm morphology is not okay. You find the sperm head being very bigger than the normal size of the head. You find the tail. Some of them, you even find out that the sperm doesn't have tail. You find a lot of abnormal shape of sperm. And how many sperm can be counted from that sperm analysis? You find out some scanty sperm, some no sperm at all. When you are doing all this to your enjoyment, you're taking your alcohol, your cigarette, you call it your balanced diet, you call it your enjoyment, things that make you happy. Do you know it can also affect your fertility? Men can also contribute to infertility cases. It is not only the woman. Don't look at your wife alone. I've listed out some of the parameters that could be contributing to men infertility. And please look into those parameters. You can go for a health checkup, check your reproductive health, as this will help. So I hope from this video today you have gained one or two things, and you have also learned that not only women contribute to infertility cases in marriage. And from this video, you have seen some of the things that could cause infertility in men. And I know you, after this video, you will go for a reproductive health checkup to find out how healthy are your reproductive organs. I hope you enjoyed this video, and I hope you've gained something from this video. Please like, comment, and share. And don't forget to subscribe to my channel. Thank you so much. See you in my next video. Bye.